for a lot of people, one of the first things that they will say is that they're sleeping extremely well. It's not like those type of medications that just kind of knocks you out and puts you to sleep, but it gives you that natural sort of kind of that restfulness that you get when you're falling asleep naturally. And it puts you in that deep state of sleep where the recovery and the reset is really happening. So peptides is a topic of extreme sort of, I think, popularity these days. And it really started, with people who are in performance, right? I mean, whether it's in the gym, athletes, but it actually started way back, like especially in Eastern Europe and former Soviet Union. Peptide has been used for at least 40, 50 years. In our body, peptides exist endogenously. So they're a natural sort of sequence of amino acids that exist in our body. So when we utilize peptides, these are not a synthetically created exogenous molecules that our body has never seen. These are actually sequence of amino acids that our body is used to seeing all the time. And as we get older, these sequence of amino acids does decrease. So the first peptide that we can talk about is within the realms of that metabolic classification. We know now that the GLP-1 agonists, such as semaglutide or tirzepatide, has really hit the general population and, quite frankly, the medical community, in shock because of the effectiveness of it and the natural consequences of how effective that they really are. Because in the past, we really didn't have much of a true sort of a uniform, effective way of reducing weight and keeping it down. But GLP-1 certainly turned that upside down. The two common GLP-1 agonists is that semaglutide and tirzepatide. So we refer to semaglutide as GLP-1 agonist. We refer to the tirzepatide as GLP-1 and GIP agonist. The newer GLP-1 agonist now, the third sort of generation of the GLP-1 agonist is retatrutide. And retatrutide works at 3 different levels. So similar to the others, it affects the GLP-1. Similar to tirzepatide, it affects the GIP. But in addition, it affects at the level of what we call glucagon receptor agonist. So not only does it affect the appetite and early satiety, but it breaks down the fatty tissues as well. And I think it is a much more healthier way of losing weight. So that's been the new development with the GLP-1 agonist. And I do truly believe that retatrutide will take over majority of the kind of the clinical treatment for weight loss. Currently, Eli Lilly is in phase 3 trials with the retatrutide, and it probably will be available sometime in 2027. Another peptide is a peptide called CJC-1295 along with an Ipamorelin combination. And these allow your own body in your pituitary system to produce growth hormones. So this is not a synthetic or an exogenous growth hormone that is released into your body. It stimulates your own tissue to release and produce its own growth hormones. And that's why it's really powerful and safe in a way in which if your body actually needs that growth hormone, it'll promote it. But if your body doesn't really need that extra growth hormone at that time, then it won't, because it basically relies upon your body to produce the growth hormones and your body to release that hormone. And growth hormone is one of those hormones, more than any other hormones in your body, that is extremely rhythmic, in that it follows a certain sort of rhythm throughout the day, where it's the most potent at nighttime when you fall into sleep, into that delta sleep, where all of the kind of the healing and reset is happening when you're sleeping at that delta state. And that growth hormone is the highest at that level. So for a lot of people on CJC-1295, one of the first things that they will say is that they're sleeping extremely well. Okay? It's not like those type of medications that just kind of knocks you out and puts you to sleep, but it gives you that natural sort of restfulness that you get when you're falling asleep naturally. In a similar class, another peptide is called Tesamorelin. Now, Tesamorelin is also a growth hormone, releasing hormone agonist. But the way that it seems to work is it does everything that the CJC-1295 does, but it seems to be more specific towards targeting the visceral fat. So when we talk about fat, normally we think about the subcutaneous fat that exists underneath our skin. That's something that we can pinch and kind of see. But visceral fat is the silent fat that exists deep inside our abdominal cavity that surrounds all of our organs. Visceral fat is made up of a special type of fat called the brown fat. And these brown fats, what they do is that they soak up a lot of energy in our body because their metabolism is so high. And so when the metabolism is too high, it causes a lot of inflammation in that region. Visceral fat is the type of fat that's even more dangerous than subcutaneous fat, and it's clearly related to our health. So anything that can possibly reduce the visceral fat is extremely important. And so when the visceral fat content is reduced, we know that the chronic inflammation of our body decreases. The next peptide, next in terms of popularity, is the BPC-157 complex, or what we call body protective complex 157. And this is a small chain amino acid that is naturally produced in our gut. And gut is one of the tissue where the turnover rate of the cell is extremely dynamic. Really, for a lot of people, every 3 days, the internal lining of our gut undergoes complete rechange. And in that setting, BPC, what it does is that it's a potent healing mechanism. So it promotes all aspects of healing, such as angiogenesis, which means ingrowth of blood vessels, also increases fibroblasts to form new collagen and new tissues in that area. And it's also anti-inflammatory in that it reduces the excess inflammation in that region. It's also a very strong immune modulator, and therefore it promotes immunity. So this is a very powerful, what we call healing peptide, and it's extremely effective for any type of healing, whether it's from a consequence of surgery, whether it's from a consequence of injury, or consequence of, even just working out and letting your muscle recover quicker. And we usually use that in combination with another peptide called TB500, which acts very similarly. They are a potent combination in terms of healing. And for a lot of our surgical patients, I find it to be extremely effective. Not just in terms of how quickly they actually recover from surgery, but also in terms of their overall swelling, as well as overall pain that they're actually feeling after surgery. I think BPC-157 with TB500 is an extremely useful peptide that's applicable for a lot of people, who has any type of healing issues that they actually need to promote. Another powerful peptide that obviously fits right in with our aesthetic practice is what we call Glow Peptide Blend. And it really is composed of 3 things. But most importantly, it's composed of a peptide called GHK-Copper. So it's a copper-bound peptide that works at the level of multiple tissues in our body, but specifically more at the level of the skin to increase collagen production. And what GHK does is that it increases collagen production, increases cellular turnover, and stimulates your stem cells. The way that we actually have created this peptide complex, however, is that in addition to this GHK copper, we also have added the 2 peptides that we just talked about, which is the BPC along with the TB500. And overall, people feel much more youthful, in terms of their skin, the texture, as well as the severity of the wrinkle improvement. SS31 works at a different site than some of the other peptides, and that is at the level of the mitochondria. Mitochondria is the area where the messenger RNA would come into the mitochondria, and the mitochondria will convert that into a protein that eventually produces ATP. And ATP is the intracellular energy that we all use. What SS31 does is that it's a short amino acid sequence molecule that can actually penetrate into the cell and go directly into the mitochondria, where it repairs the membrane of how the mitochondria folds so that the mitochondria itself can be more easily transcribed. And as we get older, that efficiency just decreases dramatically. And that's why SS31, we think, is one of the most powerful tools, in addition to NAD replacement. And people who actually get on SS31, they feel immediate boost of energy. One of the things that I should point out here is that with these peptides, you don't want your body to get too used to these type of molecules, because as time goes by, all these molecules become a little bit less receptive because your receptors become a little bit desensitized towards it. And so there's a down regulation in terms of the receptiveness of these molecules. So you do want to cycle them, meaning you have patients on it for a certain amount of time, usually 2 to 3 months, and then we would cycle them off to something else to give your body time to reset, to become like more sensitive to it, so that when we do start them after about 2 to 3 months, that it has the same sensitivity as it did when you first started them on the molecule. All these peptides are incredibly powerful, and there are a lot more. But because some of them are better for others, we really do tailor the patients towards their specific needs. Except for BPC, most of these peptides, because they're small, short amino acid sequence, they can only be delivered effectively through the injection. So it is an injection underneath the skin through a very tiny, small insulin syringes, which is a 32 gauge. And most patients can easily do it because the benefit is definitely there. One of the things that I will say about peptides is the safety. Because these are endogenous molecules, the side effect from peptides are extremely rare, especially at the concentrations that we're currently prescribing. And sourcing of where you get the peptide from is extremely important because there are so many sources now where you can get these peptides. And some of these sources are, quote, for research only. And you never know really where you're getting these supplies from. Some of these suppliers that comes from third world countries have contained a lot of impurities of what we call polysaccharides, as well as some lead contents. And so when you're exposed to things like that, obviously it's not good for your body, but also the concentration of peptides that you get, or the effectiveness of the peptide that you get, sometimes is not up to par. And so it's really important to get these peptides from the correct source, where it's at least 99.9% pure, and you have true validation through responsible physicians. And so I would urge everyone to not just order peptides from an online site, and always go through the proper channel